I wish to acknowledge the Darkinjung people as traditional custodians on the land on which I live and work. I pay my respects to the elders past and present and recognise their continuing connection and contribution to the land.
Immunisation Foundation of Australia. Supporting immunisation, saving lives.
The Immunisation Foundation of Australia is a non-profit working to save lives through education and advocacy for vaccine prevention of disease. Welcome to Matter of Vax. I'm your host, Steph O'Connell. Join me and find out what is Matter of Vax. Professor Christopher Blyth has nearly 2 decades experience in conducting clinical, paediatric and infectious diseases research, focusing on questions relevant to public policy and clinical practice. The majority of his research is in influenza, vaccine-preventable respiratory tract infection, pneumonia and vaccine safety. Professor Blyth was appointed as a member of the Australian Technical Advisory Group, TARGI, on immunisation in 2012, serving until December 2021. He is a Professor of Paediatrics with the School of Medicine, University of Western Australia, a paediatric infectious diseases physician at Perth's Children's Hospital, and he has 2 decades experience in conducting clinical, paediatric and infectious diseases research, focusing on questions relevant to public policy and clinical practice. Please welcome Professor Christopher Blyth. Let's talk about influenza. In August 2021, RACGP reported there'd been no deaths from influenza. That is a very strange reality. Same time 2020, 21,000 influenza cases and 36 deaths. And by complete contrast, in August 2019, there were 214,000 cases and 486 deaths. Influenza has seen an interesting ride over the last few years. Christopher, how are we looking this year?
Normally, and I'm going to say normally because pandemic has clearly demonstrated that things were different then. Normally we have influenza each year. In the southern Australian states, that's usually in wintertime. In the northern states, it can occur year round. And it usually circulates in the summer states during the wintertime when we're indoors, when the cough-cold season normally occurs. Now, we've learned a lot about influenza transmission by what we did with COVID. Flu went away for 2 years. We had almost unrecordable flu from March 2020 onwards for the next 21 months because the things we did for COVID worked very well for flu. One, we stopped people coming in from overseas and we quarantined them. And so in other words, new introductions weren't coming in from overseas. Also, those simple things like hand hygiene and cough etiquette, wearing masks are highly effective for flu as well. So we almost saw a near absence of flu for those first 2 years of the pandemic. But actually in 2022, once we started opening up, we saw a significant flu season, a little bit earlier than we normally expect in May. And so I do expect in 2023, we will have a significant flu season. Flu is unpredictable and it is almost impossible at this time of year to work out whether we're going to have a big flu season or a small flu season. But there is flu circulating at the moment with about 40,000 notifications so far, which is on par with previous seasons. And we've got both strains of flu circulating at this stage. So we will continue to see increasing flu numbers in the days and weeks ahead. And I'm hoping that it's a moderate flu season and many people try and take the steps they can do to protect themselves against flu, but time will tell.
It's good that you mentioned overseas travel and the impact that has on new viruses in the community. Avian flu, bird flu, not in Australia, but in countries where it currently exists, is vaccination being considered? How's it different from the flu? And what would it take Australia to consider vaccination for it?
Flu viruses infect animals and humans, and there's lots of different strains circulating. And the common animals that get flu are particularly birds, but also some of sea animals, some of the domestic animals as well. So flu is circulating all the time. And importantly, it's the generation of new viruses when things mix a bit of an animal flu with a human flu that generates new flu viruses that leads to pandemics. And the 2009 pandemic was an example of that. There is circulating bird flu. In fact, all continents around the globe have circulating bird flu. There's been less than 1,000 human cases from bird flu in over 20 years. And that's because it's not very efficient at transferring between birds and humans. And the humans that have been affected have usually been in the space of handling birds or being exposed to infected birds. But we've seen a real surge in bird flu cases globally. I think there are a number of countries that are now vaccinating birds, which is a strategy they haven't used before. We're incredibly lucky we actually haven't had any cases in Australia, and so people are incredibly vigilant for that. We do surveillance for wild birds because wild birds come internationally to our shores. I don't think we will be vaccinating birds in Australia for some time yet, but it'll be really interesting to see what happens with many of these international countries now they've started doing that.
Flu vaccine has been around since the 1940s. Is it very different now? And the eternal question that I hear asked is, why do we have to have it every year?
So we have it every year because flu is consistently evolving. Flu is a virus that actually continues to slowly mutate, and that was a concept that was quite specific for flu, but we've seen that with COVID as well. Some of these viruses continue to evolve over time. So your immunity against the circulating strains currently is not adequate because it's been derived from previous strains. So we do need to update or top up our flu immunity. And because viruses are changing each time, we have an annual influenza vaccine. And that annual influenza vaccine actually has the proteins that are present on 4 different viruses. Now, the technology we use to generate that hasn't changed greatly since the 1940s. Influenza vaccines are at best moderately protective. And I say moderately protective with all honesty, because sometimes it is actually very good at protecting, and sometimes when we don't get the strain choice right, it's not as effective as we'd like to be. On average, an influenza vaccine reduces severe influenza by about 50 to 60% each time.
Excellent. I will do just about anything I need to do to reduce my chances of flu. Winter's dangerous. How do we manage all these diseases? What's your best advice?
We've learned a lot over the last 3 years about ways to prevent transmission, and we should take that information and use that information. So, one, we know that transmission is reduced. If you're unwell, you stay home rather than going to work, going to school. So they are the most important interventions, and importantly, they're relevant for not just flu, not just COVID, but many other cough, cold viruses. And there are vaccines for some of these other viral pathogens in the near future. Many of your listeners may have been reading with interest some of the recent data about RSV vaccines, respiratory syncytial virus, which is a common virus, particularly for children, but actually increasingly recognised across a population. All those simple things as far as cough etiquette, washing hands, they all make a difference.
What's the best way of surviving the middle of the year in Australia?
We've learned a tremendous amount from COVID about how pathogens transmit between people, and much of that learning we can apply to our everyday functions and what we do. So, for example, if you are unwell, you should stay home. Clearly that message got through in COVID, and it's as relevant now as it was before. If you are unwell, wearing a mask is a tremendous way to decrease the rate of infection between you and others. And importantly, if you're in a space which is crowded and you're at risk, you may choose to wear a mask as well, because that decreases your risk of acquiring, not just giving infections to other people. And we saw during COVID, we've touched on what happened with flu, but many of these diseases actually reduced in transmission, not just flu, but other things such as meningococcal disease and pneumococcal disease are reduced during these times when we're taking these extra precautions. And the other important thing is making sure you're up to date with your vaccines, and make sure that we remain well and active and in the community.
Chris, such an honour to meet you. It's wonderful to hear from someone who's dedicated their career to influenza. thank you so much for joining us.
My pleasure.
If you've enjoyed Matter of Vax, please subscribe and share with your friends. You can also follow us on Spotify or wherever you listen to podcasts. For more Matter of Vax podcast and video education on this and other vaccine preventable diseases, visit www.ifa.org.au. The Immunisation Foundation of Australia is a non-profit working to save lives through education and advocacy for vaccine prevention of disease.
Immunisation Foundation of Australia. Supporting immunisation, saving lives.